Eating, sitting, bathing, standing, walking and traveling, dressing. This is a day-to-day routine life. Think if someone is unable to do this day-to-day life of himself and he need a assistant to perform all these day-to-day activities, routine life activities, then what would happen? This happen in a disease which is known as Parkinson's disease. It can affect anyone. It is such a disease where a chemical which is produced from the brain cells, nerve cells of the brain is known as dopamine. This chemical that control muscles movement, that control not only movement of the muscles but indirectly balance while we are sitting, standing, walking, running, traveling, whatever it is, by the virtue of your muscles and limbs. So this chemical control actually the muscles movement, and because of degenerations of this nerve and nerve cells which produces dopamine, sometime at our elder age we cannot make the balance of these muscles and we cannot even stand, sit or walk of our own, and we need always a caregiver, and it produces a stress among caregiver. This disease is called Parkinson's disease. Hello friends, I am Dr. S. K. Pandit, head of the department Psychiatry Center Hospital. Today we are here to discuss what is Parkinson's disease, what are the risk factors, and what are the symptoms of Parkinson's disease, how the disease is treated, how we can prevent it, what are the diet habits, and what are the exercises which can help to prevent this disease. Let's come with me in this video up to the end. It is not completely possible to prevent Parkinson's disease. However, studies have shown that the people whose diet includes more fruits and vegetables, fish, high fiber foods, oil rich in omega-3 and less of red meat and dairy product are less likely to develop the Parkinson's disease. Some research have shown that caffeine found in tea, coffee, cola could reduce the risk of development of disease. Consumption of green tea may reduce the risk of developing Parkinson's disease. Regular aerobic exercise may also reduce in the risk. On this World Parkinson's Day, today we are here to discuss what is Parkinson's disease, what are the signs and symptoms of Parkinson's disease, what is the treatment available, how we can prevent it, and what are the role of exercises in Parkinson's disease, which exercises particularly. What is Parkinson's disease? Parkinson's disease is a chronic degenerative disorder which affects the person's body's movements and causes loss of a balance and control of muscles. The disease usually develops when the nerve cells in the brain that produces dopamine, a chemical that controls the muscle movement, get destroyed. This happens only over a period of time, and there may not be any symptoms in the beginning. However, as more and more nerve cells get destroyed, symptoms appear and continue to worsen. So what are the risk factors? The risk factors include age itself is a risk factor. It generally begins in middle or late age. The risk continue in increase with age. Gender is the second factor. Men are more likely to develop the disease compared to women. Exposure to certain toxins, use of substance, also the risk factor for this disease. What are the symptoms of Parkinson's disease? Parkinson's disease has following 4 primary and obvious symptoms. Those are tremor, rigidity, slowness or bradykinesia, instability of posture due to impaired balance and muscle coordination, tremor of hand, arms, legs, or jaw muscles, rigidity or stiffness of almost all muscles of the limb and trunk, slowness of movement, also known as bradykinesia, sometimes complete stoppage of the movement or kinesia. In addition to these four primary symptoms, there are additional symptoms which includes pain at any part of the body, gradual confusion, increasing confusion, or forgetfulness, also called as dementia, easy fatigability, disturbed sleep, depression or low mood, lack of confidence, self-esteem gradually down, behavior changes occurs, constipation, indigestion, fear, anxiety, worriness, and age-related problems, urinary problems, digestive problems, etc. What are the treatments available and how can the disease be prevented? Relation to treatment or regarding treatment for the Parkinson's disease also varies from person to person as there is no standard treatment. The doctor will try to choose the best treatment for a person based on the combination of signs and symptoms that the person is presented with. Medicine is the option, surgery is the option, and modification in lifestyle such as getting more rest and exercise are some of the treatment methods. The best judgment is your neurologist or psychiatrist or your physician. So better if any kind of such symptoms are appear among the dependent peoples or anyone of age above 50 to 60, then it is best to visit your neuropsychiatrist, neurologist, neurosurgeon, general physician, or any doctor to get confirmed whether the person is suffering from Parkinson's disease or not. How can the disease is prevented? It is not completely possible to prevent Parkinson's disease. However, studies have shown that people whose diet includes more fruits and vegetables, fish, high fiber foods, oil rich in omega-3, and less of red meat and dairy products are less likely to develop the disease. What is the role of exercise in Parkinson's disease? Lifestyle modification and some exercises are helpful to come out of the complication of Parkinson's disease. To manage the routine life, people suffering from the Parkinson's disease, you need to consult your doctor regularly, eat well, and remain active. Maintain a positive attitude and do not get depressed if the disease makes you slow down gradually. Maintain a daily routine. There are simple activities, day-to-day activities like dressing, sitting, standing, walking, and traveling. For that, do not rush to get dressed. Instead, allow enough time to do it slowly and methodically. For example, sit on a chair with armrest for fastening buttons. Sitting, standing, and walking purpose, choose a chair with a straight back and arms. If you find sitting down and getting up difficult, keep still for a few seconds to gain balance when standing up. Remove or rearrange any furniture or object in your house that could hinder your movement or make you trip and fall. While traveling, make traveling comfortable and easier by planning carefully. Make sure you carry medication for at least a day. Now, what is the role of aerobic exercise? People with Parkinson's disease can improve their mobility and complete routine tasks more comfortably if they exercise regularly. For example, chair push up, single leg balance, and calf stretching. There are these three exercises which can help them. Chair push up can be done in following method. Put a chair with armrest against the wall. Sit on the chair. Keep the feet flat on the floor and hands on the armrest. Lift your hip a few inches off the chair by straightening your elbow. Keep most of your body weight on your arms. Do not lift your feet off the floor. Go back to the initial position and repeat it for 10 to 12 times and complete a set of 5 to 6. Second exercise, single leg balance. Always keep one hand on wall while doing this exercise and always keep a ready help nearby you. Stand with your right side close to a wall. Place your right hand on the wall for balance and do not lean. Lift your right foot and hold for 20 to 30 seconds. Repeat for 2 to 3 times. Turn and stand with your left side now close to the wall and do not lean. Now lift your left foot and hold for 20 to 30 seconds. Alternate with the left foot and with the right foot. Repeat it for 3 to 5 times. Next exercise is calf stretching. Place your hand on wall for support. Take your right foot forward. Keep your left foot backward. Make sure your heel is on the foot. Knee is straight and toes are point forward. Bend your right leg until you feel a stretch in the calf of your left leg, and then do with the alternate leg. Repeat it for 3 to 5 times. So these are the three exercises: chair push up, single leg balance, and calf stretch can help to the people living with Parkinson's disease. Thank you.